The Higher Education, Science and Training Department yesterday released the social impact of the COVID-19 pandemic on youth in the post-school education and training sector in South Africa report. The study involved young people ages 18 to 35 years of age who are either in some form of educational training or enrolled in a tertiary institution in all 9 provinces. It found, amongst others, that 53% of those who participated thought they were at low risk of contracting COVID-19. So for some reaction from the student community, we are joined now by Bongani Mahlangu, who is the National Executive Committee member of the South African Union of Students. Bongani, good to have you with us this morning. Welcome.
Good morning, Leanne, and good morning to all the viewers.
Give us your reaction to the social impact of the COVID-19 pandemic on youth in the higher education sector report.
So basically, according to the report, 13,119 individuals were sampled, and we're talking about a post-education sector that houses about 3 million individuals, 1 million of those belonging to the university branch, which is the branch of which we operate. So we do believe that the sample size used is not adequate, it's insignificant. It should have been broadened to at least 10%. We understand the challenges of doing so under such conditions, but you do it online. So we can get a clearer picture, because what we have now is that 53% thought that they were at low risk and only 15% thought that they were at high risk. And as I said, you have to understand it's diluted. So it's universities, it's TVET, it's CETs, private institutions, and so forth. But that's for that in terms of how students or how these young people believe, or the risk they believe they are exposed to. But then what we did not get from the report are issues such as quality control, because we do know that last year during lockdown, there were so many cases of cheating, so many cases of assessments not being done the right way, since they were being done online, since they were being done remotely and so forth, which we believe would have impaired quality control, if any existed. If you would remember as well, there was once a public spat between Prof. Habib then and the chairperson of the Council of Higher Education, and they were talking about the issues of quality and how quality was compromised during the lockdown. So we did not get that from the report. We did not get things such as pedagogy, which is the method and means that were used to assess or to conduct teaching and learning under these difficult times, which also would go to your assessment types, whether the formative or summative, or whether it was formative or a summative assessment used, was it adequate for such a time? So we only got more of your social issues in terms of students when they are being at home, how did that impact them psychologically, and assisting them as well. We got things such as data devices, the problems around data devices, connectivity, rolling blackouts, and how that would have affected teaching and learning. But we believe that such as pedagogy, such as quality control, they should have been added there, and then because that would have gave a clearer picture as to how students think, a clearer picture how to even staff members behave or interact towards the students, towards these young people. And another thing as well, we found that the older students said they were more prepared for life after lockdown, whereas the younger students said they were less prepared. And that could be because you realize that some students that got into the system last year have never really experienced contact learning at our universities, whereas your older students, more experienced students, probably in postgraduate levels, they would have experienced that. And in fact, they're at levels now where there's hardly any contact learning, even if it was not for COVID-19 and the lockdown thereof. There wouldn't be any contact learning. Hence, they would demonstrate a higher levels of preparedness in contrast or in comparison with their younger counterparts in the sector.
All right. So, yeah, quite a comprehensive summary of how you feel about this particular survey. So the Minister, when releasing this particular survey, had, and I mentioned it in the previous interview as well, said that, you know, as a whole, it looked like the sector managed it pretty well, COVID-19, and that they managed to finish the academic year, and it seemed to have been better than what they initially thought. What do you make of those comments? Do you think it was actually quite not smooth sailing by no means, but quite a positive outcome?
In terms of the academic side of it, of which is the core business and the reason why we are all here, is that you would remember the minister said the academic year must be completed at all costs, which goes back to what I said earlier. All costs being the compromising of quality controls, in fact, the relaxing of quality controls. Because you would remember that we have programs that were not designed for remote learning, but then overnight those programs were now transferred to online learning or digital remote learning, without actually developing quality controls in order to ensure that there's consistency and quality is not compromised. That was not done. So now what then happened was that there was zero quality, quality checks, quality assurances, quality audits from your South African Qualifications Authority, your Council of Higher Education. And what we indeed found that in some institutions or generally within the sector, pass rates went up. And that is because of the relaxed quality. And then that justifies to say, no, but then it was successful, because if you measure it, because the only way you can measure success is through throughput rates. So if throughput rates demonstrate an uptake or an increase, then you would then conclude that there was some level of success without actually getting into the nuances as to what would have contributed to that, of which we as a union believe it was because of compromised quality, because of the rapid transition from your contact learning to your remote learning without any policy to guide that transition, even though we did flag it as the union last year, but we were not listened to. And you would also know that when throughputs go up, that means then it's good for the department, because then they can generate more revenue or they can get more subsidies from Treasury. It's good for universities as well, because then they can get more subsidies from the DHET as well. So in terms of revenue, it's good for everyone except the student that would have probably progressed or probably graduated, but then they are lacking in certain graduate attributes, lacking in certain student attributes, of which becomes a problem to us because it impairs them in the long run in terms of social mobility. And that's what we don't want. As you would know, 1.5 million graduates are sitting at home unemployed, and some of them are sitting at home unemployed because of the lack of graduate attributes. So that's for the academic side. But in terms of the actual virus side, we know that by November of last year, about 3,088 people were they contracted the virus, and then from that 1,499 were staff, 1,588 were students. There were 58 deaths, and from those 58 deaths, 48 were staff and 10 were students. So I would say that compared to that, the sector houses, the university branch houses about 1 million students, and if you had to add staff, that's 1 million plus, and we have these low numbers. I would say with that regard, in terms of health controls, it is commendable, it is applaudable, even though in some instances we get those numbers because there was a resistance from university vice chancellors to allow students to come back on campus, so then they can report low numbers. But then if you had to look at by November, most universities had allowed students back. And if we get these numbers, that is something that we need to really applaud. That means the guidelines, the protocols, higher health, Department of Higher Education, students as well, because you would know we had volunteers as well, of which were 30,000 volunteers, of which 12,000 of those volunteers were students. So that means students as well did take it seriously, and other stakeholders in the sector did take it, and they're still taking it serious. Hence, we have been producing such low numbers in terms of infections, in terms of high numbers in terms of recovery, and low numbers in terms of deaths.
Yeah. All right. Just in terms of where we're at right now. So lessons learned from the first and second wave, bringing it through now to where we are. Talk to us about students and behaviours at this point.
So we have learned a lot up until now, not just students, but South African citizens in general. I think we have a better understanding of the virus and better understanding of what we need to do in order to ensure that we do not contract the virus, we do not spread the virus. So there is better understanding throughout. And also now we are in a phase where there's inoculation currently taking place. We are still dealing with some individuals that might have a negative reactions towards being inoculated, so we can push the country faster into herd immunity. But there is understanding. But also, remember, as much as there is understanding, there is still some recklessness being displayed by some students, of which is something we're every day trying to counter. As you would have seen, there was a case earlier in the year in Pretoria, University of Pretoria students that contracted the virus in bulk because they were at some party. We would have seen also in Long Street in Cape Town, UCT students, UWC students partying in small confined spaces. So we still do have such behaviors, unfortunately, but generally within the student population, there is an understanding and seriousness of this virus and what this virus can do to an individual. But also we do know that young people tend to demonstrate high levels of asymptomatism, but then they are also the biggest movers of the virus, the biggest spreaders of the virus, or even though it does not affect them individually, but it does affect those around them, more especially the elderly around them. So there is an understanding, but as I said, to be honest, there is also reckless behavior that we are still trying very hard as the union to eradicate.
Listen, we wish you the best of luck going forward and through this. But we do thank you very, very much for your time talking to this the survey that was done and the reaction from the union. That, of course, was Bongani Mahlangu, who's an NEC member of the South African Union of Students, talking about that social impact of the COVID-19 pandemic on youth in the post-school education and training sector in South Africa report.